If you're over 60, here's something that might stop you cold. Right now, at this very moment, your blood pressure could be quietly working against you, damaging your arteries, straining your heart, and increasing your risk of a stroke. And you might feel completely fine. No warning, no obvious symptoms, just silent damage building up over time. But here's what gives me hope every single day in my practice. High blood pressure is not a life sentence. And in the next few minutes, I'm going to show you 5 natural, proven ways to bring those numbers down, some of them working within minutes. Stay with me, because the 5th one is the one most people completely overlook, and it might be the most important of all. Let me ask you something. Does this sound familiar? You went to your last doctor's appointment. Your blood pressure was high. Maybe your doctor adjusted your medication. Or maybe they just told you to watch your salt and lose some weight. And you walked out of that office feeling a little unsettled, a little frustrated, maybe even a little scared, because nobody really sat down with you and said, here's why this is happening, and here's exactly what you can do about it. Asterisk over the years, I've had so many patients sit across from me and say the same thing. Dr. Patel, I'm taking my medications. I'm trying to eat better. So why are my numbers still not where they should be? If that's you, I want you to know something important. You are not doing anything wrong. You just haven't been given the full picture yet. And that's exactly why we're here today. Here's what honestly frustrates me about how high blood pressure is typically handled. Most of the conversation focuses on medication, and sometimes medication is absolutely necessary. I want to be clear about that. But what often gets skipped entirely is the conversation about why blood pressure rises in the first place, and what your body is actually capable of doing when you give it the right tools. One of the biggest overlooked root causes of high blood pressure in people over 60? It's not just salt. It's not just stress. It's something called insulin resistance, metabolic disease, and it's quietly affecting millions of Americans who have no idea it's even happening to them. We'll get to that. But first, let me give you something you can use starting today. The first natural method is one I personally use every single day, and when I tell you what it is, you might think that sounds too simple, Dr. Patel. It's breathing. Slow, deliberate breathing has been shown in multiple high-quality studies, including meta-analyses, which are some of the strongest forms of scientific evidence we have, to lower blood pressure significantly. Some studies show reductions of up to 10 points in systolic pressure. Here's the technique I recommend to my patients. It's called the 4-4-8 breath. Breathe in slowly for 4 seconds. Hold for 4 seconds. Then breathe out slowly for 8 seconds. That's it. When you slow your breathing down to around 6 to 10 breaths per minute, you stimulate something called the vagus nerve. Think of this nerve as your body's natural calm-down switch. It runs from the base of your brain all the way down through your heart, your lungs, your gut. When that nerve gets activated, your heart rate slows down, your blood vessels relax and open wider, and your blood pressure drops. Research has even shown this type of breathing can reduce what doctors call arterial stiffness, the hardening of vessel walls that drives blood pressure up as we age. Try it tonight before bed, even 5 minutes. And let me know in the comments what you notice. The second method surprised even me when I first looked at the research. It's called isometric grip exercise. Now stay with me here. This is not complicated, and it takes less than 10 minutes a day. Here's what you do. Grab a firm pillow, a stress ball, or ideally a hand grip device. You can find them online for around $20. Squeeze it using only about 20 to 30% of your full strength. Hold that squeeze for 2 minutes, then rest for 1 to 3 minutes. Repeat 2 or 3 times. That's your whole session. Studies have shown this simple exercise can meaningfully lower that top number on your blood pressure reading, what we call systolic pressure. The reason why isn't fully understood yet, but the leading theory is that the effort causes your blood vessels to open up and become more flexible, and that flexibility is exactly what your heart needs to pump blood more easily. Now, I always tell my patients, this is a great add-on, but please don't stop there. Real daily exercise, resistance training, and aerobic movement are still essential. This is one piece of a bigger picture. And speaking of that bigger picture, let me share something that genuinely changes lives when people finally understand it. What you eat directly affects your blood pressure, not just because of sodium, but because of how food affects your insulin levels, your blood vessels, and your body fat. The single most powerful dietary change I see make a real difference: cutting back on processed and ultra-processed carbohydrates. Things like breakfast cereals, white bread, packaged snacks, sugary drinks. These foods spike your blood sugar, raise your insulin levels, and over time, that chronic insulin elevation damages your blood vessel walls and drives blood pressure up. You may have heard of something called the DASH diet, dietary approaches to stop hypertension. It's a solid starting point. But what the research is increasingly showing is that lowering carbohydrates, specifically the processed kind, may be even more powerful than just lowering sodium alone. If you do eat carbohydrates, look for natural whole food sources with what's called a low glycemic index. That simply means foods that cause a slower, gentler rise in blood sugar. Think vegetables, legumes, berries. I remember a patient I'll call Summer. She was 67. She'd been on blood pressure medication for 6 years. We cleaned up her diet, cut the processed carbs, added daily movement. Within 3 months, her numbers had improved so significantly that her cardiologist began discussing reducing her medication. She looked at me and said, "Why did nobody tell me this years ago?" That question stays with me. The fourth method is one you've probably heard before, but I want to explain it in a way that actually makes sense. Number 4, exercise and sleep. Exercise lowers blood pressure. Not just a little, significantly. And the research now makes clear that you need more than just daily walks. As wonderful as walks are, a complete plan includes aerobic exercise, resistance training, yes, lifting weights or using resistance bands, and short bursts of higher intensity effort. Together, these 3 types of exercise improve how your heart pumps, how elastic your arteries stay, and how your body manages blood sugar, all of which directly impact blood pressure. And here's something most people don't connect. Sleep. Poor sleep raises blood pressure. It disrupts hormones. It worsens insulin resistance. And yet it's almost never part of the blood pressure conversation. If you're not sleeping well, that alone could be sabotaging everything else you're doing right. Start with what sleep experts call sleep hygiene, a calming, consistent routine before bed. Same bedtime, dim lights, no screens, cool room. These simple habits have real measurable effects on both sleep quality and blood pressure over time. Now for the 5th and last method. The 5th method is one that almost never gets the attention it deserves in the blood pressure conversation. And honestly, that frustrates me. Because for many of my patients over 60, this one is the missing piece that makes everything else finally click into place. It's stress management. Now before you think Dr. Patel, I've heard that before, stay with me. Because I'm not talking about just relaxing or thinking happy thoughts. I'm talking about something much more specific. Chronic stress, the kind that quietly lives in your body day after day, directly raises your blood pressure. It triggers your nervous system to keep your blood vessels in a constant state of tension. It disrupts your sleep. It worsens insulin resistance. It creates a biological chain reaction that your heart pays the price for. And here's what concerns me most. Depression and anxiety, which are far more common in adults over 60 than most people talk about openly, are 2 of the biggest long-term drivers of that chronic stress response. I've had patients whose blood pressure medication wasn't working nearly as well as expected. And when we finally addressed the anxiety they'd been quietly carrying for years, everything shifted. I remember a patient I'll call Robert. He was 71, retired, looked perfectly calm on the outside. But inside, he told me, his mind never stopped racing. He'd wake up at 3 a.m. with his heart pounding. His blood pressure reflected exactly that. We worked on his stress response together. Breathing exercises, like the 4-4-8 technique I showed you earlier, a consistent sleep routine, gentle daily movement, and for Robert, eventually some counseling to address the anxiety underneath it all. Within 4 months, his blood pressure had dropped meaningfully. Not because of a new medication, because we finally addressed what was driving it. Here's what I want you to remember. Your body keeps score of every stressful day, every sleepless night, every worry you've carried alone. And over time, that score shows up in your blood pressure numbers. So managing stress isn't soft advice. It isn't optional. It is medicine. And the beautiful thing, you already have one of the most powerful stress reduction tools available to you. And I showed it to you earlier in this video. That 4-4-8 breathing technique doesn't just lower blood pressure directly. It actively calms your nervous system, reduces anxiety, and over time, helps break that cycle of chronic stress that's been quietly pushing your numbers up. Start there, tonight, 5 minutes before bed. It costs nothing. It requires nothing. And your heart will thank you for it. Here's what I really want you to take away from today. High blood pressure almost always has a root cause. And the most common overlooked root cause in people over 60 is metabolic disease, insulin resistance, prediabetes, elevated blood sugar, quietly damaging blood vessels from the inside out. 3 things that make this dramatically worse: smoking, excess alcohol, and ultra-processed foods. Not because I'm judging anyone's choices, but because the evidence connecting all three to elevated blood pressure is simply overwhelming. When you address the root cause, you're not just lowering a number on a monitor. You're protecting your brain, your heart, your independence. One of the saddest things I hear in my exam room is this: "Dr. Patel, I figured this was just part of getting older. I didn't think there was much I could do." And I have to tell you, that breaks my heart every single time. Because aging is real. Our bodies do change. But feeling strong, energetic, and healthy at 65, at 75, even at 85, that is far more possible than most people have been led to believe. The healthiest patients I have don't see themselves as old. They see themselves as active people who happen to have more years of experience than most. That identity shift alone changes everything. So let's quickly recap your 5 natural methods. 1. Slow breathing, using the 4-4-8 technique. 2. Isometric grip exercise, 10 minutes a day. 3. Cut the processed carbohydrates and focus on whole, real foods. 4. Daily exercise and prioritizing quality sleep. 5. Targeted supplements like vitamin C, garlic, and citrulline. And always look for the root cause. If you found this helpful today, please subscribe to this channel. Because in the next video, I'm going to share with you the best foods to eat at age 60 and above to lower your blood sugar. You won't want to miss that one. And if someone you love is dealing with high blood pressure, please share this video with them today. Sometimes the most caring thing we can do is simply pass along the right information at the right time. Take care of yourselves. I'll see you in the next video.